Good morning, everybody. Today, discuss about the last portion of the antiviral drugs. What are the mechanism and what are the stage of antiviral drugs? The stage of antiviral drugs. First is the entry of the cell entry. That means attachment of the cell inside the virus into the cell, and then penetration of the cell, then uncoating and transcription of the viral genome, and finally translation of the protein. Particular protein will be synthesized that will be produce some diseases or viral infection, and assemble of the virion. That means virion is the component which is basically produce the viral disease and finally release, and this is the basic mechanism by which the infection can be produced. The viral absorption blocked by the from the HIV and immunoglobulin, and finally the penetration in the inside the cell, then the uncoating of this particular, then the genetic material will be come out, and early protein synthesis and nucleic acid synthesis, finally the late protein synthesis and the process, finally the packing and the assembly and the viral releases, and this viral is come to formation of the different types of disease, and that will be prevented by the 1, 2, 3, 4, 5, 6, 8 total 7 steps are involved to block or to inhibit the viral infection. First one is the blocked by the infovirus HIV immunogamma-globulin, that is the non-specific, and the blocked by the amantidine influenza A in case of blocked by the Formiviricin in the CM cytomegalovirus, and blocked by the purine pyrimidine analog, because purine and pyrimidine, which is the basic nucleic material synthesized by the virus, that will be blocked by the purine pyrimidine analog or the reverse transcriptase. This is the one of the most important site, the reverse transcriptase inhibitors in case of HIV, and blocked by the methicillin varicella zoster infection in case of chickenpox or smallpox, and blocked by the rifampin and the vaccination, and blocked by the neurotransmittase inhibitor in case of influenza. So these are the 7 steps or 7 sites where you can bind or inhibit the viral infection. Next is the antiviral drugs. Antiviral, in case of anti-herpes virus agents, the Acyclovir is a very common. It is the prototypes of this group. In this group, Acyclovir, Valsaclovir, and Famciclovir, Penicillin, Ganciclovir, and Cidofovir, and Foscarnet, and trifluoroidine, iodoxyridine. Another important, most important drugs. Acyclovir actually the iodoxyridine, which is used for the, especially for the AIDS patient or in case of HIV infection. The antiviral drugs like Acyclovir and congeners. Acyclovir is the prototype and it is the history. In case of antiviral drugs, the Acyclovir is the very potent antiviral agents. And Valacyclovir, it is just a prodrug prodrugs of Acyclovir with a better bioavailability. Then Valacyclovir, it is a prodrugs that is with a better bioavailability than the Acyclovir. Comparatively, it is a better bioavailability and also the less side effect than the Acyclovir. Acyclovir, the huge side effect, and Famciclovir, it is hydrolyzed to Penicillin and it is the greatest bioavailability. So these are the latest product antiviral drug which are the better bioavailability, the better therapeutic activity. And Penicillin, it is used only the topically, whereas the Famciclovir can be used or administered orally. The Famciclovir only, Acyclovir also, it is also used in the parenteral as well as the oral as well as the topical application also. Antiviral drugs and the pharmacology of the Acyclovir, because you know the Acyclovir is the prototype, so you can know thorough about the Acyclovir. After that you can just relation, there is the difference between the Acyclovir with the others antiviral drugs. Acyclovir, Ganciclovir, or these are the drugs. Basically these are all are the guanine nucleoside analogs. Basically in our base, the nucleic acid, 4 base, one is the purine base, another pyrimidine base, and purine base it contains adenine and guanine, and pyrimidine cytosine, thymine, and uracil. And especially this this type of antiviral drug like acyclovir, ganciclovir, these are basically analog with the guanosine derivative, guanosine base, and these are the different forms also. Antiviral drugs, basic mechanism of action of acyclovir and their congeners, that means others types of related to acyclovir. All drugs are the phosphorylated by the viral thymidine kinase. Thymidine kinase and thymidine synthase. There is a two enzyme. Here is the thymidine kinase, which is the kinase means phosphorylation. Kinase means they are the one ATP is utilized for this reaction, and ATP is converted to ADP. The one phosphate group is incorporated into the drugs. Then the metabolized by the host cell kinase and two nucleotide analogs, and this analog inhibit the viral DNA polymerase. Viral DNA polymerase, generally two types of virus, one is the DNA virus and the RNA virus. Here viral DNA polymerase, that is for the help for the replication. The replication, if you do not replicate, then the transcription will not occur, then finally the translation will not occur, and finally the protein will not form, and there a viral infection will be ultimately stopped. So only the activity through replicating the virus are inhibited. So in this case, in case of acyclovir, generally to inhibit the thymidine kinase, to inhibit the phosphorylation of this. If the phosphorylated form is the actual form, and they can help for the replication. If replication is inhibited, because the viral DNA polymerase, DNA to DNA, that is called replication. If DNA to DNA is not formed, there is no chance of transcription, translation, and or protein synthesis. Ultimately, death may occur of the virus. So these are the mechanism. Basically, you can know in single words, these are the stop the phosphorylation by with the help of inhibiting the enzymes thymidine kinase. Next, another antiviral drugs, acyclovir is the selectively activated on the cell infected with the herpes virus or uninfected cell do not phosphorylated by the acyclovir. I mean, those are infected that are selectively activated in the cell infected with the herpes virus, but those are uninfected cell do not phosphorylated by the acyclovir. So uninfected cell do not hamper, do not effect on the acyclovir. These are acyclovir, which market name is the Jovirax. This Jovirax is used especially for the 200 and 400 in case of the varicella zoster. It is a very potent drug for in case of measles and other types of viral infection. These are the basic mechanism by which the action of the acyclovir and related drugs. First is the phosphate groups and nucleotides. Nucleotides here the guanine bases. They are attached with the normal thymidine kinase, and ultimately guanine nucleotide form and DNA polymerase will become. They incorporate into the DNA. This is the mechanism to phosphorylation. But after this enzyme thymidine kinase combined with the phosphate to form a nucleotide, which is then the incorporated into the DNA. Here last two one is you can see it, the phosphate and the acyclovir. Here is the nucleotide. This is the basic normal mechanism by which the phosphate bind with the nucleotide, ultimately the replication or DNA will be formed. I think you can see this is the structure of deoxyguanosine and this is the structure of acyclovir. Just like this is the similar same structure, just there is a one ribose phosphate. That the basic ring structure is the same. That's why it is called the analog of this particular structure. This analog structure basically in case of just like a sulfur drugs, which is analog of the PABA, and here is the acyclovir is the analog of the guanosine. Guanosine is the normal molecule and which is help for the replication, but acyclovir is not the same structure, but there is some difference. It's little bit of difference, but usually same. That's why they bind with this. Usually here phosphate with the bind, but here acyclovir, guanosine bind with the phosphate. After it will bind, there will be formation of replication, DNA, another DNA will be formed. The normal process will be going on. But when acyclovir, you take the acyclovir bind with the phosphates, and finally that thymidine kinase and virus infected cell, and that will be the false nucleotide will be formed. Here is the guanosine nucleotide form. This is the actual formation, but here is the false nucleotide form. That means to stop the formation of nucleus. So DNA polymerase blocked by the false nucleotide, and to replication, the AG replication process, that will be hampered. I think, do you understand?
আরেকবার
বলবো। In case of normal, generally in case of phosphate bind with the nucleotide. Which nucleotide? Guanosine. Guanosine bind with the phosphate. The formation of normal guanosine kinase, thymidine kinase, normal kinase, and guanosine nucleotide is formed. Then DNA polymerase, মানে viral DNA polymerase কি করে? DNA replication করতে সাহায্য করে, মানে DNA টা তৈরি করতে সাহায্য করছে। কিন্তু এখানে কি হচ্ছে না, নিউক্লিওটাইডের জায়গায় কি এসে গেছে, যেহেতু অ্যাসাইক্লোভির খেয়েছো, অ্যাসাইক্লোভির চলে এসেছে। অ্যাসাইক্লোভিরের স্ট্রাকচার জাস্ট লাইক এ স্ট্রাকচার অফ guanosine nucleotide. So that's why they are resemble with the same structure. The phosphate bind with the acyclovir, but it is not a guanosine. That's why the thymidine kinase will be formed, but the false nucleotide, মানে এখানে যেমন guanosine nucleotide is formed, and after that then replication will be start, but here the false nucleotide is formed due to binding with the phosphate with acyclovir. The normal form টা হচ্ছে না, তার জন্য হচ্ছে DNA polymerase will not activate and the replication will be stopped. Clear? এখানে ছিল নরমাল নিউক্লিওটাইড, নরমাল প্রসেসটা দেখানো হচ্ছে, তার জায়গায় অ্যাসাইক্লোভির চলে এলো। যেমন তুমি ইন কেস অফ সালফার ড্রাগের ক্ষেত্রে জাস্ট সালফার ড্রাগ দিলে সালফার ড্রাগটা প্যারামাইনো বেনজোইক অ্যাসিডকে ইনহিবিট করছে, ফলে ডাইহাইড্রোফলিক অ্যাসিড টু টেট্রাহাইড্রোফলিক অ্যাসিড বন্ধ হয়ে যাচ্ছে। এখানে জাস্ট অ্যাসাইক্লোভির যেই চলে এলো তখন হচ্ছে ফলস নিউক্লিওটাইড হলো। এটা অরিজিনাল নিউক্লিওসাইড হচ্ছিল, তার জন্য প্রসেসটা কন্টিনিউ হচ্ছিল, তার মানে ভাইরাসটা সার্ভাইভ করছিল। তার যা প্রসেস, রেপ্লিকেশন, ট্রান্সক্রিপশন, ট্রান্সলেশন, আগে রেপ্লিকেশন হবে তবে তো ট্রান্সক্রিপশন হবে, কিন্তু এখানে রেপ্লিকেশনই বন্ধ হয়ে গেল বিকজ due to the false nucleotide form in presence of the acyclovir. Not only the acyclovir, along with this all these categories of acyclovir, I mean same mechanism if you examine in the acyclovir মানে acyclovir mechanism same, আর এই গ্রুপে যত রকম দেখছো acyclovir, cyclovir, all our mechanism is the same. Okay, শুধু just you put, যদি if the question come in case of mechanism action of suppose ganciclovir, so you can just put all these drugs or hydroxyuridine. In this case only you can put the mechanism acyclovir এর জায়গায় সেম দেখাবে, শুধু acyclovir এর জায়গায় ওই ড্রাগটা লিখে দিলেই সমস্ত ড্রাগের মেকানিজম অ্যাকশন সেম। বুঝতে পারলে? হ্যালো,
হ্যাঁ স্যার বুঝতে
পেরেছো? বাকিরা সবাই বুঝতে পেরেছে আই থিঙ্ক। মানে জাস্ট এখানে যতগুলো ড্রাগ দেওয়া ছিল অ্যাসাইক্লোভির গ্রুপের, যদি অন্য ড্রাগের মেকানিজম অ্যাকশন পড়ে তাহলে শুধু এখানে অ্যাসাইক্লোভিরের জায়গায় শুধু এই একই থাকবে, অ্যাসাইক্লোভির নাম চেঞ্জ করবে, গ্যানসাইক্লোভির, ফ্যামসাইক্লোভির অর হাইড্রোক্সিউরিডিন বসাবে, বাস একই দেখাবে। দিস ইজ দ্য মেকানিজম অ্যাকশন, মানে একটা পড়লেই সবারই হয়ে যাবে। নেক্সট, দ্য অ্যান্টিভাইরাল ড্রাগস, অ্যান্টিভাইরাল স্পেকট্রাম। What is the spectrum of the acyclovir? Actually, acyclovir is the most potent as well as this is a prototype. I mean, this is the fastest drug of this antiviral drug. It is very huge in this huge activity in the viral infection, as a skin ointment as well as the tablet or injection. Acyclovir, HS1, HSV2, and HSV, Shigella, and ganciclovir considered for CMC, cytomegalovirus, cancer, herpes genitalis, and Shigella, and for Foscarnet, which is in the HSV, VZV, and CMV. I already discussed in this full form. And the panciclovir, herpes labialis, and trifluridine, which is used for the herpetic carnectoconjunctivitis, especially for the eye infection. So these are the antiviral infection. And what are the pharmacokinetics of the pharmacokinetic, means the absorption, distribution, and metabolism of acyclovir. It is the oral bioavailability is very less, and the acyclovir is also very highly toxic also and adverse. 20 to 30% is the oral bioavailability. So distribution in the body tissue, including the CNS also, central nervous system, and renal excretion rate is greater than 80%. Basically, this drug will be excreted through the urine or in the renal system, and half-life T half is the 22 to 5 hours. The very short half-lives, but just medium half-lives, and administered topically, oral, and IV. So better, if you have better viability, you can use in the IV, or in the medium, then oral, and sometimes topically used in the Acyclovir. Third, the adverse effect of the Acyclovir: nausea, vomiting, diarrhea, nephrotoxicity, because it is most of the drug which is excreted in the form of urine. That's why nephrotoxicity is very prominent in case of Acyclovir, and formation of crystalluria just like a sulfur drugs, and hematuria also. They in case of bleeding or blood passes through the urine, and renal insufficiency. Sometimes the renal damage can be occurred due to excessive use of Acyclovir. So Acyclovir, all the antiviral and antiviral drugs, they having some adverse effect. And myelosuppression or neutropenia. Myelosuppression, that means neutropenia means neutrophil decreased number of neutrophil, and thrombocytopenia, decreased number of thrombocyte, that is platelet, and Gancivir, the same as. Next, the antiviral drug. Next, the therapeutic use. This is the most useful drugs in case of the viral infection. Acyclovir, it is the drug of choice for the HSV genital infection, HSV encephalopathy, and encephalitis, that is infection in the brain of the viral infection in the brain, and HSV infection in the immunocompromised patient, and Ganciclovir, it is a drug of choice for the HMC, CMV cytomegalovirus rhinitis in the immunocompromised patient also, and prevention of the CMV disease is transplant patient also. Their organ transplant, kidney transplant, heart transplant, liver transplant, in that case also viral drug will be used for immunosuppression therapy. Antiviral drug Cidocovir, it is approved for the treatment of the CMV, cytomegalovirus rhinitis in the immunocompromised patient, basically for the same type of action, and it is the nucleotide analog of cytosine. Or before that, Cidofovir, others drug are the analog of guanosine, but this is the analog of cytosine. No phosphorylation is required. It is directly inhibits the viral DNA synthesis. ওখানে যেমন ফসফোরাইলেশন করে বন্ধ করতে সাহায্য করেছিল, এখানে কিন্তু ফসফোরাইলেশন দরকার নেই, নো নিড অফ ফসফোরাইলেশন, বাট ইট ডাইরেক্টলি ইনহিবিট দ্য ডিএনএ সিনথেসিস, মানে রেপ্লিকেশন, and available in the form of IV, intrathecal injection, topical, and nephrotoxicity is a major disadvantage. মানে nephrotoxicity in case of Cidofovir, which is the major adverse effect, is the nephrotoxicity to kidney damage or nephral damage. Kidney basically is or nephron. Their pharmacology or the Vidarabin, which is is a nucleoside analog of adenosine. Another is the antiviral spectrum of the Vidarabin with the HSB1, 2, and VDD. It is used in the limited HSV connectors only. So these are the same. আবার ঘুরে ঘুরে চলে আসছে। The drug is converted into a triphosphate analog, and which is inhibit the viral DNA polymerase, and an oral bioavailability is very poor, low 2%. But administered ophthalmic ointment, it is better used, and used for the HSV keratoconjunctivitis, that means infection in the eye due to Pseudomonas aeruginosa in this immunocompromised patient, which is very helpful. that is used especially for the eye ointment. Anemia and SAAHDS are adverse side effects. These are the side effects. And these are the pharmacology of the trifluorides, trifluoridines, which is the pyrimidine analogs. All are the pyrimidine analogs. These are the pyrimidine analog, inhibit the viral DNA synthesis and antiviral spectrum of trifluoridine HSV1, HSV2A, and VZV, used in the limited to topical, ocular, that means in case of eye, and HSV connectors. Antiviral drugs আবার চলে এসেছি antiviral pharmacology of the phoscarnet. It is another antiviral drug. The phoscarnet is an inorganic pyrophosphate analog, and it is directly inhibit the viral DNA and RNA polymerase. Actually, DNA contains some polymerase, DNA polymerase 1, 2, 3, and 1, 2, and RNA polymerase also, the viral inversage, the transcriptase, viral inverse transcriptase. It is just not required the phosphorylation of antiviral activity. Antiviral drug of the antiphoscarnet, it is the same, oral viability 10 to 20%, and distribution to all the tissue including CNS also, administration IV. Antiviral drugs, the adverse effect of phoscarnet, especially the hypocalcemia, decrease in the calcium concentration, and hypomagnesemia, decrease in the magnesium, and neurotoxicity like headache, hallucinations, and seizures, and epilepsy type, and nephrotoxicity, acute tubular nephrosis, and intestinal nephritis. So basically these are the 4 types of side effect. One is the decrease in the calcium and magnesium, and neurotoxicity like headache and nephrotoxicity. In acute use of the phoscarnet, how it is used? It is used in the alternative drugs for the HSV infection or acyclovir resistance. When the acyclovir is resistant, in that case, because it is a different category of the drugs, not like a acyclovir, or their mechanism of action is totally different from the acyclovir, or in case of immunocompromised patient also, or cytomegalovirus or ganciclovir resistance. In case of acyclovir resistance, or in case of ganciclovir resistance and the immunocompromised patient, because what is immunocompromised patient, their immunity power is very less, that is called the immunocompromised. But their immunocompromised means immunity, when it is used, their immunity power will reject this type of drug, that is called immunocompromised patient, and in that case this phoscarnet is used, very useful drugs rather than the acyclovir or ganciclovir. Antiviral drugs in the respiratory viral infection like influenza. It is a very common, influenza is a very common viral infection. In case of influenza, you use generally the people are not used any types of drug, generally use the antibacterial drugs, but in that case you use the antiviral drugs. But sometimes if you not use the antiviral drug a certain period, or generally the 5 days is required to recover automatically the influenza. If you use the in case of influenza, you can use amantidine, rimantadine, and oseltamivir and zanamivir. These are the neuraminidase inhibitors. So in case of influenza, this type of drug you can use it, and use for just influenza. And RSV, bronchitis, and Ribavarian. In case of bronchitis, Ribavarian is very useful drugs for this type of infection. Next, amantidine and rimantadine in case of influenza, prevention and treatment of influenza A, inhibition of the viral uncoating by the inhibition of the viral membrane protein 2, a special protein. And influenza A virus, amantadine has a anti-Parkinsonian effect also. Antiviral drugs like pharmacokinetics of the amantadine, oral bioavailability 50 to 90%. Amantadine cross the extensively blood-brain barrier, whereas the rimantadine does not cross the extensively and administer orally. So amantidine is used parenterally and it is cross the blood-brain barrier in case of CNS effect, and but in case of rimantidine, then they do not cross the blood-brain barrier, only orally used. Antiviral drugs like neuromedase inhibitors, influenza, and another drug is the ganasmavir, and influenza contain the enzymes neuromedase, which is the essential for the replication of the virus. So in that case, this type of drugs, which is neuraminidase inhibitors and neuraminidase inhibitors prevent the release of the new virions, and they are spread from the cell to cell. So these virions, virions is called, it is a protein, a small protein which causes the viral infection. This virion specially synthesized by the neuromedase enzymes, but you use these drugs or antiviral drugs, this neuromedase will be inhibited, so virion will not form and ultimately the infection will be stopped. Next, antiviral drug neuromedase inhibitor influenza like and risks of the bronchospasm in case of ganasmavir. So jadher khetre in that case there is some respiratory problem, in that case you can choose their alternative drug. Do not use in the ganasmavir. And Ribavarian, it is a guanosine analog, same as Acyclovir, inhibit the RNA polymerase. There is some difference. In case of Acyclovir, which is inhibit the DNA polymerase, but Ribavarian, it is a guanosine derivative, but it is inhibit RNA polymerase. Antiviral spectrum, DNA and RNA virus are susceptible. Include the influenza, parainfluenza virus, and RSA and Lassa virus also. So Ribavarian, it is also used in case of RNA polymerase. That means RNA virus, in case of RNA virus, it is very much useful rather than the DNA virus. So antiviral drugs, Ribavarian also has a distribution all of the body tissue except the CNS. That means there is no power, penetration power of BBB, and administered orally, IV and inhalation in RSV. Anemia and jaundice are the adverse effect, not advised in case of pregnancy. Therapeutic uses of Ribavarian in case of bronchitis and pneumonia and hospitalized children, Lassa virus and influenza, parainfluenza, measles virus infection and immunocompromised patient. Antiviral drugs, they have viral infection of the interferon. This is the another most important drugs, a very newer drugs, the interferons. And lumopiridine cytosine derivatives analogs, and which is used in the HBV, and entecavir guanosine analog HAV, lumopiridine resistant strain also, and Ribavarian, which is used in the hepatitis C. This hepatitis C is very infective, not in B is the infective, but hepatitis C, it is not seen in India, basically it is seen in the Africa. But Ribavarian is a very useful drug in case of hepatitis C, and Ribavarian actually is the with interferons. Interferons are the natural protein produced from the cell of the immune system, is responsible for challenges for the foreign agents such as virus, bacteria, parasites, and the tumor cell. So interferon is a natural product which is produced from the immune systems, and that will be effective against not only the virus, bacteria, parasite, and tumor cell also. In case of cancer also, interferon also used. And antiviral immunomodulating agent and anti-proliferative, that means anti-cancer agent, and three classes of interferon like alpha, beta, gamma, alpha interferon, beta interferon, and gamma interferon, which are used for the different types of infection. Interferon alpha, beta interferon are produced by all of the cell in the response in the viral infection. Gamma interferon generally these are used for the T lymphocyte or the NK natural killer cell in the response to the cytokines and immunoregulating effect. And natural killer cell, that means to kill the cancer cell. And gamma cell has less antiviral activity compromised to alpha and beta interferon. So gamma interferon or NK cell which inhibit the cancer cell, but it is less effective than the alpha or beta interferons. And mechanism of interferon includes of the following enzymes. Number one, the protein kinase, which is inhibited by the interferons. Another is the oligoadenylate synthase, which is leads to the degeneration of the viral mRNA. That means transcription will be inhibited. Another is the phosphodiesterase, PP bond in case of nucleic acid. This phosphodiesterase bond, which is inhibited by the tRNA. The action of the enzymes lead to the inhibition of translation. Actually, phosphodiesterase to inhibit, that means first one is the protein kinase inhibition, because this protein kinase, which is very very essential for different types of metabolic action, but when it is inhibited, this protein kinase, it is very effective in case of cancer also. And oligoadenylate synthase, which is inhibit the basically transcription. Another is phosphodiesterase, which is inhibit the translation, that means protein synthesis. So this interferon is a very useful drugs and an efficient drug for the, and these effective drugs and their mechanism of action by the three mechanism of action by the protein kinase, oligoadenylate and phosphodiesterase inhibitor. মানে transcription, translation, all these process can be inhibited. Antiviral spectrum of the alpha interferons include the HBC, HBCA and HPV same, and anti-proliferative, that means in case of a cancer action may be inhibited the growth of the certain cancer like Kaposic sarcoma or hairy cell leukemia. This type of cancer can be prevented by the interferon or treated by the interferons. And pharmacokinetics, the oral bioavailability very greater than less 1% administered intestinally, subcutaneous and IV, and distribution in all the body tissue except CNS and the eye, and half-life 1 to 4 hours. Antiviral drugs adverse effect of the interferons like acute flu-like syndrome, like fever and headache, flu like influenza like. Flu means this acute, in case of immediate, you can use this drug and immediately the acute flu like fever and headache will become. Actually they use in case of cancer, but it is the fever will become, and the bone marrow suppression or depression. And the granulocytopenia, thrombocytopenia, there is a chance of another problem. And neurotoxicity and cardiotoxicity, another is the side effect neurotoxicity like confusion, seizures, cardiotoxicity like arrhythmia, that means bradycardia or tachycardia, that means increase the blood rate, heart rate, or decrease the heart rate, that is called tachycardia, and another is called bradycardia. And impairment of the fertility, in case of female, their fertility problem will be arises due to use some interferons. What is tachycardia and what is bradycardia? Tachycardia কাকে বলে বললাম? What is tachycardia? Arrhythmia, what is arrhythmia? ঘুমিয়ে গেছে নাকি সব করে? What is arrhythmia? আকাশ মাইতি, আকাশ মাইতি, পায়েল মাইতি, হ্যালো, না আকাশ না পায়েল। আকাশ কি এইভাবেই বলবে? বলো, লিখো তাহলে, হোয়াট ইজ ট্র্যাকিকার্ডিয়া? কার কথা বলার শক্তি নেই, কার কানে শোনার ক্ষমতা নেই, কার চোখে দেখার এবিলিটি নেই, যা চলছে চলুক, পরদিন তারপরে তো পরীক্ষা হবে। পায়েল মাইতি, হ্যালো পায়েল, সব মাইতির একই অবস্থা কি? দেখি অর্ধেন্দু মাইতি, এর তো অবস্থা আরো খারাপ। অর্ধেন্দু, অর্ধেন্দু, তিন মাইতির সেম অবস্থা, তিনটেই নিশ্চয়ই মেদিনীপুরে বাড়ি। ব্রততী দেখি, ব্রততী আজকে ভোট আছে নাকি? ব্রততী,
হ্যাঁ স্যার বলুন।
তোমার কি ভোট আছে আজকে না হয়ে গেছে?
ভোট হয়ে গেছে।
বাস, তাহলে নিশ্চিন্তে বলো এবারে ট্যাকিকার্ডিয়া কাকে বলে, অ্যারিথমিয়া বলতে কি বোঝো?
ট্রাকিকার্ডিয়া মানে হার্ট রেট টু ফাস্ট।
তারপর বাকিটা বলে যাও। ব্র্যাডিকার্ডিয়া,
ব্র্যাডিকার্ডিয়া হার্ট রেট স্লো হয়ে গেলে ব্র্যাডিকার্ডিয়া বলে।
তাহলে অ্যারিথমিয়া কাকে বলে? ওখানে তো ট্র্যাকিকার্ডিয়া নেই, অ্যারিথমিয়া কাকে বলে? হোয়াট ইজ অ্যারিথমিয়া? অ্যারিথমিয়া হচ্ছে আন্ডার দ্য ক্লাস অফ ব্র্যাডিকার্ডিয়া অ্যান্ড ট্র্যাকিকার্ডিয়া, এনি rhythmicity problem, that is called the arrhythmia. That means either it is a trachycardia or the bradycardia, or it is called arrhythmia. Arrhythmia মানে rhythmicity problem, problem in the rhythmicity of মানে problem in the heart rate. তার মানে হার্ট রেট কম বেশি হওয়াটাকেই বলে অ্যারিথমিয়া, কিন্তু কম হলে আমরা বলি ব্র্যাডিকার্ডিয়া আর বেশি হলে ট্র্যাকিকার্ডিয়া। ক্লিয়ার? নেক্সট, the therapeutic uses of interferons. Chronic hepatitis B and C. B is very মানে fatal. It is a infective hepatitis and life threatening, and C also life threatening. In that case, interferon is very useful drugs. And this HZV infection in the cancer patient which prevent the disease, but CMH cytomegalovirus infection is the renal transplant patient. This interferon is very useful. And condylomyata, it is a acute which gives the intestinal intralesional injection and complete the clearance is less than 50%. And here is cell of leukemia is the combination with the zidovudine, and zidovudine also very useful drugs, is antiviral, along with the acyclovir in case of AIDS related Kaposi sarcoma. But in case of AIDS, zidovudine along with the acyclovir is very important drugs, and also amantidine. So these are the class of drugs, the viral infection, virus, flu virus, disease like influenza, and the drug of choice is the amantadine or rimantadine, alternative drug rimantadine. RSV, the pneumonia, bronchitis, Ribavarian. HSV, genital herpes, Acyclovir or alternative Pharmacokinetic. Connectus conjunctivitis, trifluridine or iodoxyridine. And Acyclovir. জেনারেলি এখনো পর্যন্ত অ্যাসাইক্লোভিরের মোস্ট ইউজফুল ড্রাগস, তারপরে হচ্ছে ধরো অ্যামান্টিডিন অর আইডক্সিরোডিন and phoscarnet. And in case of hospitalized patient, the interferon is very useful in case of basically for cancer and the transplant patient also. It is normal host, no therapy. An immunocompromised host during the pregnancy, acyclovir or phoscarnet. CMV, rhinitis, ganciclovir and phoscarnet. HIV, AIDS, HIV antibody positive on the CD4, actually CD4 and CD8, and zidovudine protease inhibitor. Another is the most important enzyme in case of AIDS and also the cancer, the protease enzymes, and zidovudine is the protease inhibitors. And zidovudine is drug for the only যদি ফার্স্ট চয়েস অফ ড্রাগ হয় in case of AIDS, সেটা হচ্ছে zidovudine. You can write down this because this type of question is come in the GLET. Zidovudine basically used for the HIV, and diadenosine, which is also an adenosine derivative, and stavudine. And HBV and HBV and HCV, hepatitis B and C, used for treated by the interferons. So you can know it. This chart is very helpful for the, you can choose the in case of the multiple choice question of any competitive examination. Antiviral drug, acyclovir, Acyclovir, Pharmacokinetic, ফসকানির একই তো দেখাচ্ছে, অনেক জায়গা আবার চলে গেছে, মুশকিল হয়ে গেল। Antiretroviral drug. Actually, virus, two types. One is the RNA virus and the DNA virus. At the time, it is DNA virus. Now to start the retrovirus. What is retrovirus? Basically, the genetic material is the RNA. That type of RNA virus is called the retrovirus. HAART, highly active antiretroviral therapy. In case of retroviral, this retroviral, even this coronavirus, it is a retrovirus. This includes the least 3 medication or cocktails. These medication work in the different way to reduce the viral load. Or the three medication, or it is called cocktail. Do you know the cocktail party? রিমা ছিল দুই একবার, রিমা হয়তো। রিমা, হ্যালো রিমা,
হ্যাঁ স্যার।
do you know the cocktail?
হ্যাঁ স্যার।
তুমি জানো? পায়েল মাইতি, যখন রিমাকে ধরলাম পায়েল মাইতি অলরেডি লেফট। ককটেল জিনিসটা কি বলো? তুমি ছিলে কখনো ককটেল পার্টিতে? ককটেলটা কে বলতে পারবে? বলো রিমা, বলো 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 বলো, তাড়াতাড়ি তাড়াতাড়ি, টাইম কম। অনুশ্রী, হ্যাঁ বলি দেখে, বলো রিমা, আরে বলো, যে বলবে বলো, তাড়াতাড়ি করো। ককটেল মানে ইট ইজ এ মিক্সচার অফ ডিফারেন্ট কাইন্ডস অফ ওয়াইন। একসঙ্গে একটা ওয়াইন না খেয়ে 3-4টাকে মিক্সড করে ওরা ভাবে যে মজাটা অনেক বেশি হবে, অ্যাডিকশনটা অনেক বেটার হবে, তার জন্য ককটেল। কিন্তু এখানে ককটেল অর্থ ইউজ করা হচ্ছে যে 3টে ড্রাগ একসঙ্গে যদি ইউজ করা হয়, যেমন ইন কেস অফ টিউবারকুলোসিসের রেজিমেন্ট থেরাপি বলে, এটা হচ্ছে ককটেল বলা হয়েছে এই কারণে যে 3টে অ্যান্টিভাইরাল ড্রাগ একসঙ্গে যদি ইউজ করা হয়, তাহলে এই রেট্রোভাইরাল ইজ ভেরি ভেরি ডেঞ্জারাস দেন দ্য ডিএনএ ভাইরাস। তো তাদেরকে কিল করতে বা ভাইরাল লোডটাকে কমাতে গেলে 3টে ড্রাগ একসঙ্গে যদি ইউজ করা যায়, তাহলে ভাইরাল লোড উইল বি রিডিউস। সো দ্যাটস ওয়াই ইট ইজ ডিনোটেড এজ এ ককটেল, জাস্ট ইট ইজ জোকিং, not in other way. What are the basic mechanism? Be careful, we listen it. First is the reverse transcriptase inhibitors. What is reverse transcriptase? Reverse transcriptase actually enzyme in case of RNA virus. The basic genetic material is the RNA, and their replication is not DNA to RNA, DNA to DNA. It is RNA to RNA. But when it is introduced into the host like humans, their RNA material, RNA is converted to DNA, and that is done by the reverse transcriptase. Reverse transcription হচ্ছে DNA to RNA, but when DNA to RNA, it is transcription. When RNA to DNA, and it is generally seen when the virus infected into the host cell like DNA. হিউম্যানের ডিএনএ রয়েছে, কিন্তু অর্গানিজমটা নিজে ভাইরাস, নিজে আরএনএ, তাহলে তার ক্ষেত্রে কি হবে? একমাত্র যদি তার রেপ্লিকেশন করতে হয়, তাহলে তাকে হোস্টের সঙ্গে রেপ্লিকেশন করতে হবে, এবং যদি সেটা আরএনএ টু ডিএনএ হয়, দ্যাট ইজ কল্ড না, সেই যে আরএনএ টু ডিএনএ এই যে প্রসেস রেপ্লিকেশনের, এবং তার সেটার জন্য যে এনজাইমটা লাগে সেটা হচ্ছে রিভার্স ট্রান্সক্রিপ্টেজ। প্রসিডিওরটা হচ্ছে রিভার্স ট্রান্সক্রিপ্টেজ অ্যান্ড ব্লক। তার মানে এই যে RNA টু ডিএনএ এর মধ্যে ইন্ট্রোডিউস ইনটু দ্য হোস্ট সেল, সেটাকে যদি সেটা কি করে না, রিভার্স ট্রান্সক্রিপ্টেজ এনজাইম, ওটাকে যদি ব্লক করা যায়, তাহলে কি হবে? হোস্টের সঙ্গে কিছুতেই অ্যাটাচমেন্ট হবে না, অ্যাটাচমেন্ট না হলে পেনিট্রেশন হবে না, পেনিট্রেশন না হলে প্রোটিন তৈরি হবে না, প্রোটিন তৈরি না হলে ইনফেকশন হবে না। তাহলে দ্য ফার্স্ট টার্গেট হচ্ছে টু ইনহিবিট দ্য রিভার্স ট্রান্সক্রিপ্টেজ ইনহিবিটার্স, block the activity of the enzymes reverse transcriptase and preventing the production of new viral DNA. ওটা আর ডিএনএ তৈরি হবে না, কারণ হিউম্যানে তো ডিএনএ হয়, আরএনএ ডিএনএ দুটোই হবে, কিন্তু এখান থেকে আরএনএ থেকে ডিএনএ, ভাইরাল ডিএনএ আর তৈরি হবে না। নাম্বার 2, রিভার্স ট্রান্সক্রিপ্টেজ ইনহিবিটার্স or nucleotide reverse transcriptase or nucleosides or non-nucleosides and nucleotides. What is nucleotides, non-nucleosides and non-nucleotides? Example are the, তার মানে either nucleotides mean base, sugar and phosphate, it is called nucleotides. If it is not present, that is non-nucleosides. Another the nucleosides is base and sugar, without phosphate it is called the nucleoside. আর যদি সুগার না থাকে, অনলি বেস, তখন বলা হয় non-nucleoside. Clear? An example is these are the drug and their market name given in the Lamivudine, Tenofovir, Acyclovir. These are the drugs which are used for the retroviral. Do you understand? What is nucleotide and nucleosides? Rima? Rima? Rima?
হ্যাঁ স্যার
বলো, what is nucleotide, what is nucleoside? কি বললাম? কিছুই বললো না। ঠিক আছে, পরে আমি দেখছি। তাহলে ফার্স্ট ওয়ান ইজ দ্য ফার্স্ট টার্গেট এরিয়া, যে ককটেল বললাম তিনটে জিনিসকে টার্গেট করে। একটা আছে টু ইনহিবিট দ্য রিভার্স ট্রান্সক্রিপ্টেজ ইনহিবিটার্স। নাম্বার 2, protease inhibitor. Protease is one of the most important enzyme to growth development of the cell. Inhibits the protease retroviral enzymes and preventing the viral replication. Example, Amprinavir, Indinavir, and Naprinavir, Ritonavir, and Sequinavir, and all are market name given here. So they are basically inhibit the protease. তাহলে ওই ড্রাগগুলোর ক্ষেত্রে লিখবে সব সময় reverse transcriptase inhibitor. These are the protease inhibitors, and protease is very important enzymes. Another is a fusion inhibition. 3 technique বলেছিলাম cocktail হিসেবে। fusion inhibition of the viral, fusion preventing the viral replication. Viral এর সঙ্গে viral protein এই যে CD4 cell and CD4 and CD8. CD4 in case of AIDS also, the CD4 এই যে ভাইরাসের সঙ্গে অটোমেটিক যে সেলের রিয়াকশন, মানে আরএনএ ভাইরাস উইথ CD4 সেল অফ লিম্ফোসাইটস, এই যে অ্যাটাচমেন্ট ফিউশন হয়, সেটা যদি বন্ধ হয়ে যায় তাহলে আর হবে না। The newest class of antiretroviral drugs example is the enfuvirtidine, already marketed, launched in the marketed. Fuginon, enfuvirtide, basically used for the fusion between the CD4 cell of lymphocyte with the retrovirus. In fusionটাকে বন্ধ করে দিচ্ছে। Antiretroviral drugs combination with the multiples. Antiretroviral medication are common and adverse vary with each others, and many adverse monitor the dose and limitation of toxicity, and monitor the sign of the opportunistic disease. Sometimes some diseases is come or growth due to use some drugs, that is called the drug induced, and sometimes it is called the opportunistic. The numerous antiretroviral drugs adverse effect, numerous and vary with each others. Drug therapy may lead to the modifying because the adverse effect. Goal it is to find a regimen that the best control for the infection with tolerable adverse effect profile, and medication regimen can change during the course of illness. যে সাইড এফেক্ট, যাতে মেডিকেশন সাইড এফেক্টটাকে লেস করা যায়, যেটাকে আমরা ককটেল বলছি, অর ইট ইজ কল্ড দ্য রেজিমেন্টস, সেটাকে প্রবলেমটাকে মিনিমাইজ করা যায়। একসঙ্গে ইউ আর ইউজিং দ্য সাইমালটেনিয়াসলি 2 or more drugs to reduce the side effect as well as the increase the activity of the drugs. Actually, we are thanks to this Dr. T.V. Rao, MD for medical and pharmaceutical students. I help for this, and I convey my regards for this person, and I use this slide for your lecture or for betterment. Thank you very much. If any question, please ask me, or if you given in the chat box my YouTube channel. Thank you very much. Any question? রিমাকে কি বলেছিলাম?